Okay, well, thank you so much. So let me first explain the 10,000 feet view of my research. So as we all know, there are so many different kinds of practical and methodological challenges with the existing data sources and analytic approaches, which prevents us from generating the robust scientific evidence to guide public health policies. So the overall goal of my research is to develop the new data stream and analytic approaches that will allow us to overcome these challenges. And I'd like to show some examples of my work to illustrate how I have been trying to do this kind of work. So this is the first the study that estimated the cumulative incidence of SARS-CoV-2 infection based on seroprevalence data, accounting for antibody waning. So back in early 2020, we were wondering how many people have been infected by SARS-CoV-2, because that will allow us to understand the population level immunity against SARS-CoV-2. But then the seroprevalence data would be a great source to estimate that. But it turned out the antibody targeting SARS-CoV-2 wanes over time and go below the detectable level. So what I tried to do was to integrate the sero-survey data with the mortality data and put them into the Bayesian model and estimated the timeline of waning and also the cumulative incidence accounting for waning antibodies. So that graph over there shows a result for New York City. And these black dots are the CDC's seroprevalence. And then the red line is the estimated cumulative incidence accounting for waning antibody. And using this model, we were able to estimate the proportion of the population ever infected in all 50 states. And these results have been shared with the state DPH and CDC to inform their COVID-19 control measures. The next example was we aimed to identify the optimal timing to administer the second dose of the mRNA COVID-19 vaccines. So in order to estimate that, I linked the vaccine registry data with the surveillance data at the individual level, and then used the target trial emulation approach. It's one of the causal inference techniques. And the result is shown for the Moderna recipients in Georgia, but we compared three different timings of the second dose administration. The FDA recommended, which is 4 weeks after the first dose for Moderna, and the late but allowable and late. And we found that delaying the second dose by about 10 days would provide stronger long-term protection. But if you delay it longer, it's actually not good. It would actually increase the risk of infection. So there's kind of like a sweet spot there. And my plan is to conduct a similar study for PCV, pneumococcal conjugate vaccines, and rotavirus vaccines. And the last example is from my One Health research. I'm a veterinarian by training. So the zoonotic pathogens can be transmitted to humans through the contaminated water, food, soil, and animal contacts. But it's so interesting that we don't know how many infections are coming from each of these pathways. So in order to understand that, I integrate the human infection data with the exposure source data and climate data and put them into the transmission dynamic modeling, which can tell us something like this. If the foodborne pathway is reduced by 50%, the total Campylobacter infection would decrease by 30%. This is the result from Maputo, Mozambique, the capital city of the country. And my future plan is to understand how this kind of contribution of different pathways change by weather and climate so that we can identify the optimal climate resilient control measure that is specific to each setting. So thank you so much.